Hi, my name is MediStop. In this video we will talk about epiglottitis. Epiglottitis is the word used for the inflammation of the epiglottis. Epiglottis is a small cartilage that covers the larynx. Its role is to prevent foods or liquids from entering the airways. When we eat or drink something, the epiglottis moves down, so the respiratory tubes are closed during the ingestion process. In this way, the food does not enter the trachea and the lungs. On the other hand, epiglottitis appears when the epiglottic structure is swollen, so its sizes are bigger and it can occlude the airflow through the larynx and the trachea. Epiglottitis is a life-threatening event. It can appear at any age, but it is more frequent in children between 3 and 6 years old. This happens because a child's airways are particularly smaller than an adult's, so the obstruction occurs more easily. However, the main causing factor is the Hemophilus Influenzae type B bacteria. Fortunately, the prevalence of this infection has become lower due to the standard administration of the anti-Hemophilus Influenzae vaccine in infants. The clinical picture has 5 important symptoms. We will remember them by using the mnemonic FROST. F stands for high fever. In some cases, this might be the first symptom the patient experiences. R is for respiratory distress. The child arrives to the hospital with moderate or even severe respiratory distress. This is why he adopts the tripod position. In this way, the larynx and the trachea are aligned, and the respiratory effort is reduced to the minimum. O stands for odynophagia. Usually, it is an intense type of sore throat. Besides that, it can be associated with sialorrhea, which is hypersalivation, a very important hint. During the examination of the oral cavity, do not put pressure on the tongue. This can cause a reflex contraction of the laryngeal muscles, which will worsen the respiratory problems even more. S stands for stridor. A stridor is the sound made by the patient during the respiration process. You don't need any special instrument to hear this sound. It is caused by an obstruction of the airways. In our case, it is a swollen epiglottis. T stands for tripod position. This is usually noticed during the physical examination, and it is very specific for patients in respiratory distress. So, here are the FROST symptoms. As far as the diagnosis is concerned, epiglottitis is an emergency. If we suspect that a child is suffering from epiglottitis, he needs to have an X-ray taken immediately. The X-ray of the neck will show specific changes. The normal sharp contour of the epiglottis has now a more rounded aspect due to the inflammation and the edema that surrounds it. After the X-ray, the child is taken to the OR. Under general anesthesia, we will intubate him in order to ensure the airflow to the lungs. Using the laryngoscope, we will seek confirmation of our probable diagnosis. Then some tissue samples will be taken, so the cultures show that this is an infection with Hemophilus Influenzae type B bacteria. We need to use antibiotics that are active on this microorganism. Fortunately, the edema is quick to respond to therapy and the mechanical ventilation can be stopped within 72 hours. With that being said, here we finish this episode. I hope you enjoyed it, and if you did, hit that subscribe button to never miss more content like this. In the last episode, I explained how does subarachnoid hemorrhage work. Check the link in the description, maybe you will like it. Check my channel for more medical videos like this one. Thank you for watching. See you in the next one.